Heartburn is a very common GI complaint. In fact, maybe 40 million North Americans have complained of heartburn, pretty regularly. And it's described as a burning, uncomfortable sensation, usually in the chest, sometimes in the upper belly. And it's a typical symptom of GERD. Now, GERD is a disease, actually. It's the most common chronic GI condition that there is. And it's involving the reflux of stomach contents into the esophagus, sometimes up to the throat. And so GERD includes heartburn as a symptom, but GERD can also be manifested as other symptoms, such as regurgitation. Regurgitation is a different sensation where you actually feel stuff coming up into your throat or your chest, liquid or even solid. You feel stuff in your throat is painful, you have hoarse voice, sometimes you have asthma, and so those are called extraesophageal symptoms of GERD. So we see patients in a multidisciplinary fashion, particularly focusing on patients with refractory heartburn. And these are patients who already have taken over-the-counter medications or prescripted antacid medications from their primary doctors, who have some response. Their heartburn is relieved, but they still have regurgitation, they still have breakthrough heartburn, waking up at night. And then sometimes you actually have to do something different other than medication. And these are some of the services that we offer. For example, we actually are able to rebuild the valve that promotes the reflux of content into the esophagus, either by doing it endoscopically or in a minimally invasive fashion with surgery. Now, we can actually offer a transoral incisionless fundoplication, or a TIF procedure, which is relatively new but been around for about 8 to 10 years. And what we do is, in an outpatient procedure, we try to increase the resistance of the sphincter muscle at the end of the esophagus by doing a gastroesophageal plication from the inside during an anesthetized procedure. This is actually pretty minimally invasive, and patients can go home the same day. They can actually go back to work typically within the week. And if, again, the hiatal hernia of a patient is too big to fix endoscopically, our surgeons can also try to fix this and rebuild the valve surgically. Some of the other conditions that we treat include complications of GERD. For example, Barrett's esophagus. It's a change in the lining of the esophagus that is a known precancerous condition. It predisposes to esophageal cancer. So it actually occurs in about 5% of patients with chronic GERD, and esophageal cancer is a very deadly disease. So we actually can try to get rid of the Barrett's by either doing laser, burning with radiofrequency ablation, freezing with cryoballoon ablation, and these treatments are pretty safe, pretty successful outpatient endoscopy procedures. Finally, we can also treat complications of GERD like strictures of scar tissue that can result from many years of injury and scarring. And sometimes these are very difficult strictures to treat that need dilations or stenting or a steroid injection, and sometimes we actually have to do surgery in some cases.
Making an appointment with the Heartburn Center is very easy. You can simply Google Johns Hopkins Heartburn, where it will direct you to the Heartburn Center website. There you can find an email, heartburn@jhmi.edu. Once I receive that email from you, I will answer it within 24 hours requesting your medical records. Once I receive your medical records, I will pass them on to a physician for review. We will have the ability to streamline your clinic appointment by ordering tests and procedures prior to your clinic visit with a physician. You will have the ability to meet with me one-on-one to go over your treatment plan and answer any questions that you have in regards to your plan.